Well, I have my guest, Jag, who is on the line from the Northwestern Melbourne Primary Health Network. And good afternoon to you, Jag. How are you?
Hi there, Wilma. Very well this afternoon. Thank you.
Thank you very much. And thank you for coming on to the Midday Panorama program, because I know you're a very, very busy man. And for our listeners, Jag has a very large title, but nevertheless, he has told me it's validated. He is known as the Executive Director, Service Development and Reforms. Gee, that's a mouthful, isn't it?
It is a mouthful. It's not the most easy-flying title, I'm afraid, but I'm probably more interested in the work that we do than the titles that we have, to be honest with you, Wilma. So really grateful to have the opportunity to come and talk to you and your listeners today.
Good on you. And not only that, obviously you're very worth it of it as well. So please tell us a little bit of the background on the North and Western Melbourne Primary Health Network, Jag. I'd really like to let our listeners know what it's all about.
Yeah, great. So look, Wilma, we're one of 31 primary health networks across Australia. We're funded by the Commonwealth Government, and look, key for us really, our role is to improve the healthcare experience and outcomes for communities within our region. So, as our name suggests, our region is Northwest Melbourne, which is quite a large region actually. We cover right up to Woodend and out past Werribee in the west, as well as the CBD area of Melbourne. So a beautifully rich and diverse part of not only Victoria but indeed Australia.
Wonderful.
But a lot of the work that we do is really focused on working with community and service providers to understand what the service needs and gaps within the region are. And then we design, often with community and service providers, how to respond to those needs and then fund the services to meet those needs.
And I was going to say to Jag, and especially the most vulnerable as well and at risk, yes?
Absolutely. Look, that's our sort of primary focus, is making sure those people that are at most risk of the poorest health outcomes don't fall through the cracks, that actually there is a response for them, and we're working to improve access, experience and outcomes for those people that are most vulnerable.
Yes, and just so that we're quite clear here, that you also support many people across the board here, and so where can we also get support and existing primary care service providers? So tell us a little bit about that.
Look, often the most important starting point for primary care services and the most familiar access point is our wonderful GPs. So that's where most people go when they're seeking to access a primary care service. And that's never been more important than our current time, given the impacts that we've got with COVID. We've actually got a campaign at the moment where we're encouraging people to see their GP. What we found in recent months with the impact of COVID is people have been really concerned about going out to their GPs and maybe staying away even when they have had a need to access support and help.
That's so true.
They've been reluctant to go. So, we recognise that, there's been really good management of the COVID outbreak in Victoria, and the messaging around stay at home and avoid congregating in public places has been really well responded to by community. But one of the consequences of that has been, it seems that people have delayed accessing primary care support or going to see their GP, whether it's to manage their chronic disease or whether it's to get a prescription. It seems that people have been staying away. So, really key message from us, it's okay to see your GP. Contact them. All GPs in the region have got arrangements in place to see you safely. There's been some really quick adaptations to using telephone and video consultation to see people, but there are still safe ways for GPs to see you in person at the clinic if that's what's required. So what we're encouraging everyone to not delay, but contact your general practice, have a conversation with them about needing to come in, and they can work with you as to what the best way is. Should you come into the surgery, and what consideration are there for that, or whether you can be seen and consulted with by telephone or video. So don't put it off. I think it's so important to keep looking after your health, more so now than ever. I think also what we're finding is just the impact of people being somewhat more isolated at home and out of routine, and just the general impacts we're seeing with COVID, and the experience of that is making people more aware of their mental health. And actually, I think for all of us, even with some of my work colleagues here at the PHN, we've been talking ourselves just about how we feel like our mental health is somewhat, needing attention during this time. So really encouraging everyone to recognise that it's okay that we need a little support right now. It's actually not expected. It's quite common. Reach out, get some professional support. Your GP is a great place to start. But I'm really keen to get your listeners to know that we're going to share some phone numbers as well. So it might be worth, if you've got a pen and paper handy, grab it. If you need to run and get that now, it'd be great if people can get that. And if you're happy, I'd like to also share some other information as to how people can get mental health support really easily when and as they need it.
Well, absolutely. So can I mention CAREinMIND?
Absolutely.
Yeah.
Absolutely. So CAREinMIND is our suite of mental health services that we commission, and one of those is our CAREinMIND Wellbeing Support Service. It's available free of charge. It's available 24/7. You don't need a referral. You don't need anyone's permission to access it. Anybody can use the number, which I'll just read out now. It's 1300 096 269. Simple number, staffed, as I said, 24/7 by qualified, experienced mental health professionals who are there ready and waiting. If you are needing to have a talk to someone about how you're feeling, if you're experiencing any type of mental health distress at the moment, that's a really, really good service to access, and qualified people there to guide you through. In fact, I was talking to one of my neighbours the other day, and she was talking about just how she's been struggling just at home, not able to go through her usual routine. She's really felt a little bit overwhelmed. So I encouraged her to use that number and reach out on 1300 096 269 to the Wellbeing Support Service. And she's actually the best advocate for it now. And she was telling me that she's been telling all of her friends about it, and just encouraging everyone to keep the number handy in case they need it.
Well, that is very good, because at the moment, I think everything that you have just mentioned is so true. And if someone is listening today out there and is feeling a little bit not right, and especially being overwhelmed with what's been happening in the past, I'd say 4 months since probably late Feb, you please, there is counsellors there to assist you on CAREinMIND, a wellbeing support service. And as Jag had mentioned, it is free. It's a 24/7, and you can call them. They are professional counsellors that will guide you and assist you and talk to you. And that number is 1300 096 269. And we're going to talk more about some numbers and some more connections. But as we go further on, one of the main biggest issues here, Jag, and I know that you're quite passionate to talk about this, the mental health and related areas during the COVID-19. Tell me the big picture on that.
Well, big picture, I think certainly in my lifetime, I've never experienced anything like this. So I think the impacts that COVID have been very far-reaching, and some of the things that we're hearing from our service providers, some of the things that we're hearing from our community contacts is just the sense of loneliness that people have experienced through COVID, through the isolation. So that's been a real big feature. But I think also what we're hearing a lot of is just I'm going to use the term sort of mental health distress. People have been feeling, and there's a lot of factors causing that. I mean, we've all, as much as we love our families, we've all been at home, confined, and out of our usual routines, and that's put a fair bit of pressure on families and relationships, kids studying from home, partners, ourselves sometimes also not able to go to work, or actually, many people have suffered a loss of income or loss of work during this period. I mean, we've been reading about the impact in terms of the travel industry and hospitality sectors. So those have been big drivers for stress. I think that's manifested itself or resulted in lots of different things. But fundamentally, I think there's been a lot of distress that people are experiencing at the moment. So really keen to just remind everyone that it's okay at the moment. I think we're all feeling a little bit of need for a little bit of extra support and support at this time, and it's okay to reach out for professional support. Let's be kind to ourselves. Let's be kind to ourselves. Let's be kind to others. Let's look out for each other. But most importantly, let's reach out for the support that's available. Again, the distancing message has meant that some people have felt that they can't reach out and access support, but it is available. There are people still in many circumstances providing face-to-face services with distancing, but those services are also available by telephone and video, and many are available free. So the number that we gave there for the Wellbeing Support Service is one, but really important to take the opportunity to talk through with a professional how you're feeling, what's happening, and access the supports available. We spoke there about loneliness. That is a really present theme at the moment, and across all age groups. So one of the things that has been set up recently, and I think it's a Commonwealth-funded initiative, is really around a COVID Connect service. So again, a telephone-based service, which is available free, and it's really a place for social contact. So, there are people at the end of a telephone line available and willing to just have a conversation. Isn't it so important, the human contact we have with each other? And if we can't do it face-to-face at the moment, then just using the telephone, using the internet, and if you've got access to things like FaceTime or others, just keeping connected with our friends and family, even more important at this time.
Absolutely.
But I did want to, Vilma, just mention the COVID Connect phone number.
Yes, I'm happy to.
Some people might find that really useful.
Yes,
that's 1-800-733-276.
Yes, and I'll just repeat that. It's the COVID Connect free call-based social connection for those experiencing isolation. And that number to call is 1-800-733-276. And it is important for yourself and your well-being to reach out. And keeping in mind, it is free, and it is a based social connection for those experiencing isolation. And as you were saying, Jag, it's not... It's everyone. Everyone's feeling that uncertainty. Everyone's feeling the strain of the many months that have gone by with the COVID-19. It really has put a spanner in the works, and it's made you rethink, and I use the word reset, a lot of priorities. And it just shows you how important it is to connect and to be surrounded with loved ones and people and friends and family. But, things like this will not last forever. But in the meantime, we do need to be very mindful and look after our health, physically and mentally. And these are avenues where people can call, and especially if our listeners are feeling that isolation or feeling overwhelmed with everything. And as Jag has mentioned, and even I will mention, it's okay, because it is an overwhelming period that we are going through. But there are services in place that you can reach out and get some more help. So I suppose, in a nutshell, what are you doing now to help right now as we speak?
So we've got a range of things happening right now. Vilma, I think the key messages that we've been giving are really around, do reach out and seek support. Speak to your GP if you're not sure where else to go. We're working very closely with our service provider partners. We don't actually deliver services ourselves. As I said before, we fund organisations and providers to do that. So we're working very closely with them around how we can support them in the delivery of those services. So a lot of the services that were previously provided face-to-face have adapted to now also being available by telephone and using video as another way of connecting. We're also working really closely with general practice to make sure that they've got the right information and access to the appropriate supports they need to keep doing the work that they're doing. There are a lot of other allied health services in the region, and we're also making available masks and timely information to them. So we've actually set up a web page portal where all service providers across the region can jump on and see what the latest advice and guidance is in one really easy to access place. But I just wanted to pick up on something really important you said there. I mean, you made the reference to looking after ourselves, and we often refer to that as looking after our physical health, but mental health is equally as important as
absolutely.
our physical health. And no more important time for us to be focusing on that. So some of the things that I've been talking about with my friends and my family have been around, where can you go to just have a reference point to get some tips and guidance and, just develop your own understanding and awareness of what else is available. So just wanted to give a plug for a website called headtohealth.org.au.
Absolutely.
So headtohealth.org.au is a really good starting point in terms of identifying what the range of digital supports and services available. So there's lots of helpline numbers, there's lots of websites. Sometimes, it's really difficult to know where to start and where
definitely.
to look. So that's a really good place as a starting point. There's also really good information there on how to look after yourself, how to look after your family and carers. One of the things that I found really useful there, we've got 3 children at home, my wife and I, and one of the things we were talking about is how do we talk to our children about what's happening right now? Because they're quite anxious, they don't understand it.
No.
And how do you actually start that conversation with them? So headtohealth.org.au's got some really good tip sheets and information as to how to start those conversations and how to address some of that health anxiety that people are feeling. And that's really, really common right now. We've been talking to our providers around what are the sorts of concerns that people are presenting with, and there are a lot of people that are really anxious right now as a result of COVID and maybe the risk of becoming infected, what that means, as well as everything else we spoke about, just the impact of us, perhaps not having active work, needing to be at home. So, we've been using that Head to Health website as a point to direct people to. But again, just highlighting again.
Yes, I will.
Yeah.
Headtohealth.org.au, and I'll repeat that again, headtohealth.org.au. And it's a good starting point to find reliable and trusted online program forums and also phone services as well. Now, I would like to ask you, as we have mentioned probably earlier, but how is Northwestern Melbourne Primary Health Network helping during the COVID pandemic? And you did say like general practitioners, mental health, community service, and what other areas of other trusted information is there apart from what we're talking about today?
Yeah. Look, so those are some sources of information. We also have a whole range of other services that are continuing to be available. And our website, again, sorry, I'm referring to a lot of website resources here. Isn't it interesting how, we sort of got these new ways of storing and making information available. But our website, nwmphn.org.au, if you type that in with a /system of care, we've actually got a directory there that you can search of all of the services that we fund, and they're searchable there by location, age, group, community of interest and location. So hopefully a really easy way to navigate a whole suite of services that are available that people could make use of right now, but into the future as well. But look, I think the key thing also that we will continue to do is to work with providers to understand what supports they need, but really again, really keen to understand from community, how do we support you to have confidence in accessing services right now? Please don't delay at getting support, whether
Absolutely.
that's physical health and seeing
And
your
mental
GP
wellbeing.
or mental health.
So
We're also doing some planning at the moment, which is not necessarily just related to COVID, but we've been working with community and with service providers to develop a mental health plan for the Northwest region. So that's ongoing work, and really keen to get more community input into that. We've spoken to about 600 people across our region so far, and there's another website here, I'm afraid, but blueprintforhealth.org.au is a website we've created to enable people to contribute to that dialogue and put their hand up and let us know if they want to be interested in how they can participate to that, or give us some feedback in terms of some of the work that is happening. So I think that dialogue is ongoing in terms of what is actually working for people right now, what isn't working, and how do we work together to fix that, to make it a better health system in the northwest of Melbourne.
Okay. Now, I was just going to ask you to, especially when it comes to mental health and homelessness and getting that support during the pandemic. I think, as we have mentioned, I think your best port of call at this point, and as a directory service, I think we'll tell our listeners that you can go to and I'll just repeat this very slowly, nwmphn.org.au/system of care. Now, that is a directory of all services, and so you can go to that. Also, you have COVID Connect, which is free, which is a social connection for those experiencing isolation. There is a 1-800 number. I'll repeat that. It's 1-800-733-276. And also you can go to headtohealth.org.au for other points of online programs and forums. Now, let me ask you this: so what sort of services does the NWMPHN support? What other services apart from what we're talking about today?
Yeah, so a lot of our work is with supporting general practitioners, pharmacists, allied health practitioners, but also working with local hospitals to understand how is the connection between those services that are provided within community best made to those services that are delivered in a hospital environment. So there's a whole range of services right across Northwest Melbourne that we work with. I mean, as I said, from a community perspective, it's so beautifully diverse. We've got, one of the most diverse communities in Australia. So we work with a range of services that sometimes work with particular communities also. So there are a number of organisations focused around culturally and linguistically diverse communities that we work closely with, but also with LGBTIQ community service providers. So it's so important that that services are available in a way and a place that is safe and people feel safe to access and understand what their particular needs and requirements are, and are able to support engagement in that way. So,
Jade, what support can I get in the northwestern region, please?
Yeah, so Vilma, there's such a wide range of supports available. I mean, today I guess our focus is really around mental health services. So around the areas that your listeners will be familiar with, there's a whole host of services which range from some of the telephone-based services we've spoken about. There's also, we have psychologists and mental health nurses and mental health social workers right across the region also. But there are also other additional services such as Headspace, which are targeted more at young adults and
young youth,
adolescents. So there's a whole suite of services out there. And I guess one of the challenges that my friends and family often raise to me is I don't always know where to find them. So again, really important to make that first step, to recognise that it's good to get professional support when you need it, and if you're really not sure where to start or where to go, your GP is often a really, really good starting point.
Well, it sounds it sounds like the GP is obviously your port of call, and also I do believe that the GP does give you, I think, is it how many, 10 sessions if you need to go and see someone as well, a professional.
That's right. So your GP can refer you to, if you need psychology support, can refer you to a psychologist to get that support. Look, sometimes that's 10 sessions, sometimes it might be more, it might be less. It really depends on what somebody needs.
Absolutely. Yeah. And so my question to you is, how can I access the NYMPHN funded services? How can I access that?
Yeah, so some of the ones that we've spoken about, such as the Wellbeing Support Service, literally just pick up the phone, dial the number. It's free. You don't need a referral. With some of the others, we spoke about the System of Care webpage. The directory there provides all of the details in terms of whether you can just refer yourself or whether you might need to go and see your GP first and ask them to refer you. All of that information is detailed there. But I was also going to give our pharmacist colleagues a plug as well, because we sometimes forget about the important role that pharmacists also play in connecting people.
And that's important too.
Yeah, that's right. So, I think, again, it's making that first step and just recognising that all of these health professionals will be really keen to help you.
Absolutely.
So hopefully, I think some of the services we've outlined there before, really good places to start.
Good on you. And I suppose most importantly, do I have to pay for this service?
Great question, and such an important question, particularly at this time, isn't it? I think when many of us are feeling
a lot of people are not working either,
stretched and under pressure.
Yes.
Look, so all of the services that we've spoken about today are available free of charge. So, including the Wellbeing Support Service, including if you are needing to see your GP, or many GPs bulk bill and don't charge an additional fee, but that's such an important question.
Well, it is a very important question, but at the same time too, I think everyone, as you had mentioned, we're all, I'm a little bit over it trying to hear this, we're all in it together. Well, it's quite obvious we are all in it together. But at the end of the day, I have found, even myself on my travels, or if I've gone to my GP or pharmacist, everyone is very helpful. Everyone is willing and obliging. I found even the culture has changed quite dramatically. People can feel that what other people are feeling at the moment. I don't see a lot of selfishness. If you would have told me about 5 or 4 months prior to this, I'd probably have a different way of having this conversation. But since the COVID has hit us here in Australia, I think everyone is really pulling together and doing the best that they can, and the politeness is there. Initially, the past three weeks when we were hit with the COVID, there was a lot of aggression, and as you would know, in the supermarkets, people were very not at ease at all, and it was in for one, and everyone was just trying to do what they had to do, whether it was food supplies or whatever. That now is really eased off, and I think people are coming to terms of this situation and slowly easing and hopefully moving forward. But even with the hygiene levels everywhere you go, in the shops or whether it's pharmacy, wherever, the hygiene is there. The sanitising levels are far and beyond, which is absolutely fantastic. Even the greeting, our mindset has changed, and I think people's attitudes now have softened quite a lot. That is my experience, and even going to the doctors, I mean, he will be sitting 1.5 metres away, and they do ask, how are you going and how are you coping? So personally, I found that the people in general and the culture in this environment that we're in is a lot more easier than what it was when it initially started. So therefore, once again, some people are still struggling and finding it very difficult. But if you are wanting to reach out and get more support, please, I'm going to give you a number now. It's CAREinMIND. It's Wellbeing Support Service. It is free. It's a 24/7 telephone counselling service. And please reach out and call this number. It's 1300 096 269. It is very important to reach out, and that's why we are having this program this afternoon, to be able to reach out and try to connect to others as much as we can. Also, a directory of all the services funded by the North West. The Northern Western Health Primary Health Network, and that website is www.nwmphn.org.au/system of care. Now, if anyone has missed all of this, please do not hesitate to, you can contact the station on info@northwestfm.org, and I'll give you that again, info@northwestfm.org, and more than happy to assist you with more information if you've missed the numbers. Also, COVID Connect. It is a free call-based social connection for those experiencing isolation. That is a very important number to call. It's 1-800-733-276. And also head to health.org.au for a starting point to find a reliable and very trusted online programs, forums and phone services. So how can we make mental health system work better for people, Jag?
I think there's, as I was describing before, that we've been having lots of conversations asking that same very important question. And I think what I'm interested in is really understanding from those people that have used the system, what has worked for them and what isn't working. So the regional planning that I spoke about before from the blueprint for health.org.au, really key to get input into that from people around how do we make that work better? How do we make it the best that we can for the Northwest region?
Absolutely. And as we had mentioned, those services are the services in the region would be like Moonee Valley, Moreland and the Hume. But once you do call and navigate your way through the system, you can reach out and there'll be someone there wanting to assist you, which is very, very important. Well, Jag, I can't thank you enough, and all the team from Northwest Melbourne Primary Health Network. I cannot thank you enough. And for your time this afternoon, and really making it quite clear to our listeners that there is help out there. You can reach out, and there are good supports in our local area and across the board as well. Is there anything else you would like to contribute before we conclude this afternoon, Jag?
No, great, Vilma. I just wanted to take the opportunity to thank you and your listeners for giving me and us the opportunity to talk here. And I think really just reminding everybody, reach out, be kind to yourself and others, and keep connected. So important.
Absolutely. Well, thank you and all your team. We'll talk again. You have a great afternoon and a great week ahead. And thank you so much for coming on the show, because I know that you are a very, very busy man. So you have a great afternoon and we'll talk very soon.
Right. Thanks, Wilma.
Thank you.
Bye.